Hello, 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 and welcome back to IVF in Your Pocket, your waiting room companion. In today's episode, I have nurse coordinator Tracey Rauen here to talk about the 5 tips for optimizing physical health on the IVF journey. I'm so thrilled to have Tracey joining us today.
Great. Thank you so much, Alexandra. I'm so happy to be here, and I hope that I give some really good information to the patients out there who are listening. My name is Tracy. I am a nurse, and I've been a nurse for almost 40 years, which seems impossible.
Wow.
I know. That is a long time. I have always been involved in women's and children. I started out in the NICU, moved into family education at some point, and then came to fertility, IVF, about 15 years ago. So, women and children have always kind of been my focus. I love it. I love the area. So, very dedicated to it. I have also gone through IVF, so my knowledge sits on both sides.
That's wonderful. So you bring an incredible perspective to our show. Thank you so much for being here. So tell us a little bit more. What are the 5 things, the 5 crucial tips that listeners need to know to optimize their physical health for IVF?
Absolutely. So, in the Bay Area, we actually have, I would say, a high proportion of women who are in very good health. California itself suits itself to being outside, to exercising. But sometimes we could help out a little bit. We could focus a bit more. So some of the things that I would focus on is one thing is diet. Um, we want to optimize our diet and how it relates to A, what we're taking in, but B, also our weight. And in our clinic, we see average weight, we see underweight, we also can see some overweight. It is very important to optimize that weight and make sure that you're at a healthy weight, whether it's under, whether it's over, because that does affect fertility. High A1C, if we see a thyroid level that is out of whack, that's too high, these can all cause delays in treatment. So seeing a primary care physician and saying, hey, we are looking to start our family, or we've been trying to start our family and it hasn't been working. What can I do to help increase and make those factors better before I go ahead and consult an RE? How can I help? How can I help this journey along?
Great. And that sounds crucial also during the IVF journey itself. So, optimizing diet, nutrition is a crucial component physically to ensure really getting the most out of IVF.
Absolutely. The next thing is exercise. Again, obvious, we're a lot of people are outside exercising, it's great. The exercise that I'm talking about is can sometimes be to the extreme. We have a proportion of patients who run the marathons, who swim the beta breakers, which is fantastic and amazing, and what's keeping you in great health. What I would recommend to our patients is to make sure that you're being completely honest and letting your physicians know exactly your exercise regime. Because when you go through IVF, we're going to ask you to cut back on your exercise once you start your stimulation. And this can be very distressing to some of our patients who find exercise to be a huge part of their daily activities. And it can kind of throw them off balance. And that's not what we want to do. We want everybody to be as peaceful within this process as they can. There's already so much stress in it. So I want you to know that we are going to ask you to go ahead and cut back on your exercise, but I also want you to let your physician know exactly what that looks like, because I have had patients who I'm discussing things with, and I say, okay, we're going to go ahead and start your stimulation on this day. And I may get a little pushback because, well, I'm training for a marathon, I'm training for a triathlon, and I will honestly say, well, that's not going to work with the schedule that we currently have right now. So why don't you go ahead and do your marathon, triathlon, whatever it is that you're going to do, and come to us when you're finished. But again, they've been waiting. They're finally in. They're talking to me, which means we're ready to go. We're ready to start stimulation. And again, that can cause a problem. Wait, that's not what I wanted. Nobody told me. So I am here with Alexandra to tell you that we will ask you to cut back on your exercise when we
Mhm.
start your stimulation. Uh,
Absolutely.
we we ask for things like no bending, twisting, no heavy weight lifting, no heart rate above 140. And the reason for these restrictions is that we want when once you put your body to a certain level, the oxygen is prioritized to heart, lungs, excuse me, brain, and it is not prioritized to the other areas such as ovaries, uterus, that kind of thing, which is where we're putting all our time and effort in. Um,
Totally.
as
Yeah.
far as the twisting, that has to do with we are hyperstimulating the ovaries. So imagine balloons that maybe have a teaspoon of water in them, and now we're asking them to hold a half a cup. They get heavier, they can twist on each other. It's called torsion. It doesn't happen a lot, but because it can, again, we want to remove all the risk factors that we can. So we do ask for a reduction in exercise, but it's important that you let your doctors know how much exercise you're doing a day so that they have a sense of what it looks like in your daily life.
I know there are three more tips you want to give here.
Yes.
So we have nutrition, exercise. What are the other three?
Lifestyle is another big one. There, we will ask you questions, and during this process, it's so important to be honest with your physician. Honest in what you're eating, honest in how you're exercising, and honest what your lifestyle looks like. And by lifestyle, not only if we talked about diet and exercise, but I'm talking about alcohol consumption. I'm talking about nicotine. I'm talking about vaping. I'm talking about marijuana usage. All legal where we are. Great. But it does and can affect your fertility. And because there can sometimes be a stigma with too much alcohol, too much vaping, too much marijuana, people will not be completely truthful in how much they are doing vaping, smoking in a day. It is really important that you give us this information because we are going to ask you again to reduce or delete this from your activities. This can be difficult for people. We see it a lot. And to kind of go cold turkey, again, very distressing. We don't want all this stress in your life, but these are the factors that we're going to ask you. These are the factors that we're going to ask you to change. And so you need to be prepared. And again, coming into it, can you possibly start reducing that beforehand? But I want you to know that it does affect it and that we will ask you to change, reduce, or delete it completely from your daily living.
Great, really good to know. And then I know there are two more that you wanted to cover today in the episode.
I did. One of the things that I do love, or I loved when I was going through acupuncture, and I have recommended it through, or excuse me, IVF, and I've recommended it to my friends, is acupuncture. And there are certain practices that are like, hey, we're all in on this. There are other practices that are like, science is fine, but it doesn't have to happen. I feel strongly that acupuncture is a great support. I think physically it brings you into balance. Mentally, I will tell you, it was actually a really great mental balancer for me. I
Mm.
would not even have to tell my husband that I was going, and he would come home, and after a few minutes of speaking and kind of interacting with me, he's like, "So, did you go have acupuncture today?"
It's that effective,
Well,
yes.
what makes you say that? And he's just like, you are just more peaceful after
Mm.
your acupuncture. And I was like, oh, and I am peaceful there. I literally, I can feel my heart rate and my blood pressure drop as soon as I walk in the door. And even after IVF, decades after IVF, I still do acupuncture.
Great. So we have diet, exercise, lifestyle. Of course, always important to be honest about all these things with your care team. And then I know there's one more tip that is probably, in some ways, we might say it's the most important, crucial, which is,
Which is the timing of your medication.
yes.
Oh, dear patients, we are not trying to be mean. We are not trying to tell you what and when to do. But one of the big things that we see in IVF is somewhat of a lack of respect of the medication timing.
Mm,
So when we talk to you about medication, we talk to you about timing, we mean it. It is important to take these medications at the correct time. Again, different clinics. Let's say you choose 7 o'clock. Some clinics will say you could give it as early as 6 or as late as 8 o'clock. That's great. Some keep it a little tighter. They have like a 30-minute window. I want you to pay attention to that. We have actually, my injection service, we have actually been hired by patients in certain instances because they say, Tracy, if I don't have to be accountable to you, I will give my medication whenever I feel like it.
wow, wow.
So, and we get that. We get that people are busy. We have clients, I mean, all over the world, and they have every type of job. So we have seen it all. We know you're doing this, we know you're doing that. But the timing of these medications is important. If you have a concert that you already booked a ticket for, you need to consider how you're going to get that medication because maybe that concert is up in Napa. We for some reason we see that a lot, that there's concerts in Napa
Yep.
and they want to give their medication at 4 o'clock instead of the usual 8 o'clock. And I will tell you that your clinic is going to say, no, that's not going to work. We
Hmm.
want you to give it tighter. So I know it's hard to give up commitments, but this should be the most important commitment while you're going through it. But once you commit, you have to commit. And the most important injection is the trigger injection. That injection has to be at a very specific time. We will give you this information over and over and over about how specific the time has to be. And we talk about if you give it an hour late, to call the physicians. And some of my patients will kind of push back and say, Trace, what's an hour? I want you to know that what an hour means is that I have 7 other patients who will have retrievals that day. You will go to the end of the day. We will not push them. They have taken their
Yeah,
medication on
of
time.
course.
Their time is already confirmed. You will go to the end of the day. That could possibly put you 5 to 7 hours later. That is a high risk of ovulating before your retrieval.
We don't want that.
No, not at all. All that work, all those eggs that are sitting there just waiting for us, we do not. So if I had to say anything, please, please, please take your trigger shot on time. And I
Yes.
will, when I am setting my patients up, I will say, set your alarm right now. I want you to set it for 30 minutes beforehand, 15 minutes beforehand, and then the time of. Even as a nurse going in and giving the injections, I set my alarms because the patients will start talking to me. They'll ask me questions, and it's very easy to go past that
Yeah.
time. So
Yeah.
you will find me, even as the professional, setting my alarm on my phone.
Okay, so to our listeners, please take that medication on time, set the alarm. Tracy, thank you so much for being here. Just to recap some of your amazing tips for optimizing physical health on the IVF journey is, of course, being honest with yourself and your provider, watching nutrition and diet, really paying attention to exercise and not overdoing it, really being honest with yourself about your lifestyle and what needs to be cut back, as well as your care team, and really utilizing things like acupuncture, which can really make a difference in your mental state. And finally, being precise with medication timing. Yes. Tracy,
Please.
thank you so much for being here. We really appreciate it. And until next time, listeners, remember you are not alone.
Thanks, Alexandra. Take care.